first presentation of the day is on the topic of care, connection, compassion. How Rockpool repurposed a brand new residential wing in response to COVID-19 with our presenter, Melissa Argent. Melissa is the CEO of Rockpool Residential Aged Care. She has over 20 years of diverse healthcare and financial services experience. Early in her clinical career, Melissa found her passion for the aged care sector and has since worked in a variety of specialties, both in Australia and internationally. Her experiences have reinforced her commitment to ensuring the provision of exceptional aged care services. Welcome, Melissa, and over to you.
This is my family now. You know, I've adopted this place as my family. This is my home.
So good morning, and thank you, Simon, and thank you to the team for the invite to speak today. As mentioned, my name is Melissa Argent and I am the CEO of Rockpool Residential Aged Care. And I wanted to show you that video just to set the scene a little on who we are. It's not often we get to visit and be inside each other's facilities, and today hopefully is for us to learn a little bit more about each other as we work through this challenging time that we're facing. So we are a 150-bed facility north of beautiful sunny Queensland. So sorry if it's a bit chilly where you are, Simon, but it's a beautiful day up here in Queensland. We're about 30 minutes north of Brisbane City. And I guess for us, our philosophy here at Rockpool is that everybody has a story, a lifetime of expectations that have shaped who they are and how they live. And for us, being part of that story is an absolute privilege. So today, the topic is how we redefined a residential wing in response to COVID-19. For me, it was a really interesting day. I started in this role on the 30th of March, which was essentially the day that Queensland and the rest of the country went into wider restrictions. And I set the scene with that as it's a very interesting day on day one to start in the role of CEO. But for us, it was immediately working together in what was a time of crisis and really ensuring that as a team we were calm and methodical, and what a great way to get to know each other really quickly. Early on in our planning, we had really distinct points that we worked to, that we thought if we work to this, we can't go wrong. And that is always focus on the resident. So in everything that we do through this planning was if we keep the resident and their families at the centre of what we do, we can only do the absolute best we can to ensure their safety. We focused a lot on lessons learned from overseas, and as we all know, there was an awful lot in the media, there were some devastating stories that our industry was facing, but it was also leveraging our relationships within the community, what the local hospitals were seeing, what they were hearing from their peers overseas and in Australia. So there was a lot of lessons learned, and as you all know, we still are learning a lot of those lessons today. And the third and final thing was we did need to plan for the worst. Let's prepare ourselves for what we were possibly facing, and we can only work backwards from there. The residents and their families, as I said, was absolutely first and foremost our priority. It was at this point that we decided it was necessary to have absolutely one distinct manager to work through this time. And I have to absolutely acknowledge the wider team, but I do say on here our superstar care manager, Karen Conroy. In times of crisis, we need to support all of our team, and particularly our care team look for one distinct manager to be calm and methodical as we work through what we're facing. It was really important early on that we established really strong links with our local hospitals, and of course we do have those relationships. But as we all saw popping up fever clinics, telehealth was new to an enormous part of our services, and Radar up here in Queensland is our local public health unit. So it was about establishing and enhancing the relationships that we already have with those providers, as we were receiving information so quickly, and information was changing, as you all know. I guess for us, the biggest thing that we did, and we have to acknowledge that we are a facility in ramp up. So we opened in October last year. So we were in the lucky situation where we had some spare and available beds. What we did was make the decision to actually repurpose one of our units that was not quite full with residents, but did have residents. And we made the decision to isolate this particular unit for a couple of reasons. One, this part of our facility has two distinct entries and exits. So we could actually have entry through the main entrance of the facility, but we also had an opportunity to provide an entry and exit directly onto a car park and through a really safe exit where people did not need to come and go through the main doors of the facility. The lessons learned from this is this will now absolutely form part of our future outbreak management plan. It was an excellent opportunity for us to make sure that people could enter and exit very safely and in absolute privacy. It did involve some very quick negotiations with the residents and their families, and as I've outlined here, it was our memory support unit. I have to acknowledge the staff that did this in a really quick time frame, but also our families that were so accommodating to work with us around the movement of their loved ones, and certainly our residents absolutely embraced it. So within a 24-hour period, we had residents moved outside of their usual home and up into a vacant part of our facility. We tested immediately, and I know that we all were trying to keep up to date so regularly with guidelines so that we were testing when necessary, but for us, following those guidelines, we tested immediately, so we did not have anybody in isolation unnecessarily. And communication was a really big part of this. So regular communication was necessary, and I couldn't say that, you know, immediately we got this right, but we certainly got better at this. It was certainly something we tried to do really well, but as you can appreciate, there was a lot of communication between our team, between our residents, between our families, and then also trying to truly understand with what was being said in the media and what we were hearing was true and correct. I've highlighted just on this slide a little bit around our resident feedback, and as we all know, one of the hardest things that we had to look at and implement was restriction of visitors to people's homes, and for us this was something that we didn't take easily and lightly, but of course our resident safety was utmost, and our staff safety was of utmost importance. So for us this is really reassuring. We had a fairly reasonable response rate to these surveys, and it was really reassuring to see that people felt safe during the period of restricted visitor access over the past 3 months. Excellent to see that we did provide enough information, and really importantly, our staff felt supported during this early period. So this for me was a great highlight that we were on the right track. By this stage, we had residents moved, we had areas isolated, and we were prepared to take on whatever COVID was going to throw at us. Some representative feedback that I just want to highlight was Did our family representatives feel that our access control was the right decision? And I'm sure we've all had ad hoc feedback. We all had our own thoughts around restricting people to see their families. What is really reassuring that on week one, most people were absolutely supportive of and truly understood why we were doing what we were doing. In fact, in my rounds in talking with the residents and their families, some of our families actually said, thank you for making the decision for me. Whilst I feel really torn that I want to be here, I also want to keep my family and myself safe. And a lot of our representatives were in the high-risk age group, so over 70 and did have other comorbidities. What was really, really reassuring to me is on week 6 that absolutely people did agree the decision we made was right. It's interesting to continue to monitor this now, and I think as time goes on it gets a little more difficult, albeit restrictions have somewhat eased, but as we know what our peers are going through interstate, we're looking at more changes. So this for us is something that we'll monitor, and I think as an industry we need to work together to make sure we've got a consistent message and doing what we can within the guidelines to keep our families and residents safe. I'll highlight a little more about what we did with the team and repurposing the area that we had set up. So we did implement a 12-hour roster for the care team, and our staff were absolutely willing to do this. We talked with them and we negotiated around why we did this, and it allowed for teams to come to work, be well supported to work the 12-hour shift, and it allowed for extra backup staff as we endured and worked out what we'd really need to roster over the coming few months. We did have some backup rooms that we actually set up in case of staff illness, and I'll talk a little later in the presentation with regards to the feedback we did get from our staff. But we have a workforce where they had small children at home, where they were caring for elderly parents, and a lot of the feedback we had from our staff was they are more than happy to come to work, but they were scared at times to go home, but also what would happen if they did come to work and got sick. So we actually immediately set up 10 rooms that we had in case of staff illness, and these could be fully isolated from the rest of the facility. And the idea with that was we worked through the treatment that those staff needed. Were they at the point of hospitalisation? We took advice from our public health unit. I'm thankful that we never got to this point, but certainly from the learnings that we had both in Australia and overseas, if we have a safe area for our staff to isolate themselves with the appropriate equipment, it was absolutely an advantage. Something that we've seen so much of in the media is personal protective equipment. We were in the fortunate situation that we did have adequate PPE. We had plenty accessible, and we had the rooms set up with the PPE at the doors ready to go. So in the case that we needed to quickly implement the use of PPE, it was there and ready to go. The last thing we wanted was staff wandering around and needing to look for it. I think we've all seen some challenges in this space, but we are and continue to be well stocked. And the support locally up here in Queensland and across the industry was that I know that we'd support each other if there were issues with our peers having access to PPE. Senior management working from home. Again, this was something that we implemented with the repurpose of the wing, and something that's now formed part of our outbreak management strategy from both now and into the future. And that was, we immediately kept some of our senior staff off-site who could undertake their usual duties, but they worked from home in the event that we did have an outbreak and that we had our staff unfortunately affected, so that in a quick change we could bring staff that knew our residents, knew our families and knew the facility back into the workplace easily. And thankfully we didn't need to utilise that tactic, but absolutely something we will do as we go forward. It was on day one that we kept at minimum 2 of our senior staff working from home, and they had the capacity to act in the role of care manager, acting facility manager in need, and could absolutely provide care at the bedside if necessary. Really early on, the tax on our team was obvious, and I think on all of us. There were times where we were all scared, and still continue to be. We had incredible support from our local businesses, and it took our hospitality team just a couple of quick calls to those businesses that remained open through this time. And I do have to call out Domino's and Zarafas, who provided an enormous and very generous amount of vouchers to our healthcare team. So within the first week, we obtained pizza vouchers and some coffee vouchers just for our staff if they had done that 12-hour shift on their way home to pick up pizza for themselves and their families, or to grab a coffee on the way to work. And in fact, this local support has continued. I have to say this went a really long way for our team, a small token of appreciation, but a great way to build the ongoing engagement and ensure that they know that they're appreciated. We did survey our staff and we had positive results. And one of the really important things for us was to truly understand their understanding of COVID-19 and the effects. This was a new virus, and whilst we're used to dealing with viruses, do we truly understand what it means, what the symptoms are, what the treatment is necessary, and most importantly, simple things like how to apply PPE. We are a new facility, so we have new staff, and whilst they've been through competencies, it's not every day you apply PPE. So going back to the basics, to give our staff the confidence to say, please help me, I don't know. The staff feedback has been really positive. We had an enormous response rate in week one about the support. And I just highlight the fact that I take it really seriously, that I know that our staff are absolutely supported, and of course we have their back. It was really encouraging feedback. Our week 8 check-in is of real interest to me. So again, really positive feedback that a majority of our staff, bar one, perhaps didn't feel as supported as they thought. For me, it's truly understanding what they see as support, and we'll continue to work through that. What I do have to highlight here is the really reduced survey rate. And I think it's fair to say that our team, our residents and our families are probably a little surveyed out. And I think even from my own personal experience, everywhere you go through this time, you're required to fill in your details. We're asked about flu vaccinations, and rightly so, but I do feel our staff need a little bit of a break from being surveyed, and it's just more important that we're out there walking the floor and talking with them through this, what we've learned, what we need, and we'll continue to do that. What we did well was responding to the changes in legislation, and as we all know, this was coming thick and fast, and we did receive exceptional support, but a lot of information. So how do we digest that and get that out to our teams quickly? And I'll talk a little bit about how we approach that soon. We did provide education and support to our staff. It has to be out there one-on-one at the bedside, and particularly the repurposing of a wing and setting it up needed a lot of support for our staff. It was really all hands on deck. It was setting up the rooms, it was setting up the PPE. We had specific staff talking to families and residents and making sure we had the time given to those family and residents to understand what it truly meant to repurpose the wing. And communication, and it's a bit of a double-edged sword. We did it really well at times, and certainly we reflect back and there was times where we could have done it better. Some of the areas for improvement, which is really interesting and again, really great feedback from our teams, was letting our care staff know about the changes before families so that they can prepare and be adequately prepared to talk to families through that. As I'm sure you all do, we put the information out as quickly as possible, and often that was at times to our families and to our staff at the same time. The community, it was absolutely a focus of ours throughout this time as well, and we heard terrible situations locally of people that couldn't get essential or hard to find items, and we all saw the toilet paper debacle. So we actually put together some care packs for our local community and our local hospitals who were seeing inpatients in crisis, and some of the teams that we work with had people coming to their door in absolute crisis and they didn't have the resources. So one of the things we know that we can do is we did have great essential items and we had enough. So there's a photo there of Jamina, our resident relations manager, who was out there and working with our local church community groups and care support groups to make sure those in absolute need did receive some of the supplies that they required, and they were our most vulnerable. So homeless, people in domestic violence situations, and again, inpatients in local hospitals who had arrived with really nothing from their home. Something that we did, and it was really interesting feedback when I did a lot of review of the industry about what does our community and our team really need through this time? And amongst everything else we did, it seems unusual to say we launched Facebook. And it did go live in May, but it was in response to many of our staff and many of our families saying, I've got Facebook, I've got it on my phone, I'm still going to work and I can access it immediately. It's a great way to share information. So we did, and it's still a work in progress and something that we will continue to move forward with. I do want to highlight a couple of our key achievements through this time, that being we did continue to recruit and onboard new staff, and we did this through a virtual orientation, and kudos to my extended team who put this together. It was really important, and particularly through a ramp up, that once we knew we would get through this COVID situation, we had enough staff to continue to care for our residents post-COVID. We knew we'd potentially have staff that would need a break and that we were facing an incredibly unusual and busy few months. And it was a great way to support our workforce that we continued with virtual interviews and virtual orientations and that we could welcome them to the workforce when they could start. The use of technology is very topical, and I can see the topics presented later today. We were able to implement technology, and it's one of our gorgeous residents there using technology for her birthday. But what we do know is sometimes all the fabulous and fancy technology is not for everybody, and certainly not always in the age group of our residents. So it goes back to the Facebook launch, and truly what was it that our families and our residents wanted? I think it's easy for us to assume what we think they might like, but really what is it that they like? And we've had great success with the use of Zoom and Microsoft Teams to allow residents to connect with their families. One of the other important things was the phone and access to the phone at all times of day for the residents. And our care staff really took that on board to make sure that there was absolute easily accessible phones for our families and residents to connect. I think we've all been in this place. We have a very strong management team, and we had to be clear and concise and methodical in our approach. And what was really important is that we did agree, but it was often after healthy debate. You know, we all bring with us an enormous amount of experience through and living in various situations. So we often did have to have healthy debate, and I think we need to do that around truly what's right for our residents and our families. Adapting to this situation, as we're all doing, is ongoing, and we have tried to be really creative with our facility. So not only did we repurpose the wing, we repurposed some of our outdoor areas to set up for family members, which allowed for appropriate social distancing, but it was set up in a way that it was like a home. So, and we implemented appropriate cleaning after those changes were implemented, and we still do that now. So, and again, something that we will look forward to doing for the foreseeable future. For us, and as I outlined, we are a new business up in Queensland, and we have developments that are ongoing. And through this phase, we did continue on our new site development. We have a new facility due to be commenced in January at Castledine, which is, again, north of Brisbane. So it's about the lessons learned from this. You know, I think we all have to think about this as our new norm. What have we learned from this, and what will we learn differently? What will we do differently with our new sites? There are absolutely some lessons learned, and I really do want to spend a little bit of time on this slide. It's easy for us to have an assumption of knowledge. Our methodology of education needs to be varied. It's not a one-size-fits-all, and at a time where we were busy, we had to really think about and truly understand what our staff needed and empower them to feel open and honest. If they weren't comfortable in applying PPE, let us walk through it with you. Staff were scared. We were all scared and continue to be at times. You know, this is a whole new world in which we're facing, and I think it's really important to acknowledge that vulnerability, and let's work together as a team, not only here at Rockpool, but with our peers out there and with the industry. And I commend the team for pulling this event together, because I'm sure we've all got so many lessons learned from each other. Our GP engagement, and for all of us in residential aged care, this is an essential component. And again, this is something that we got better at because we made the assumption that GPs would visit as normal and that they were truly up to date with aged care and restrictions. But we really need to take the leadership here and talk with our GPs and plan their visits, witness their flu shots. Again, another assumption that is really easy to make. So we've only grown our GP engagements and relationships, but probably something I would do much sooner. It did. It wasn't overlooked in the fact that GPs are a fundamental part of our business, but it was something that we assumed, and we need to make sure we communicate with them with regards to our updated restrictions and what we're doing with our residents and families. Communication was a little scattered early on, and we absolutely did get better at this by redefining our admin roles. And we redefined that to have one person that managed the communication both to staff and families, and this is where we saw great improvement. And it was a responsibility, excuse me, of that person to truly keep up to date with real-time data that was coming through. And as you know, it was often multiple times a day where we received information. That work is still ongoing, and in fact something as an organisation we're looking to do. As a startup, we've got a great admin team, but it's often all hands on deck. So we have, again, aligned one specific role with regards to communications and public relations. We do have bidets in our facility, and in a toilet paper shortage, what a wonderful opportunity. It's again something that was really important and that we will continue to review, but it certainly assists with infection control measures and interaction with the residents. It's definitely a watch this space. It's quite new in our industry and new here in Australia, and something that we're working on, and we'll look to do a little bit more research around. We do have a robot named Rosie, and she is also a great help in situations like this because she's obviously got strict infection control measures. But the advantage with having a robot on site is to decrease staff touch points. And certainly our idea was to have Rosie working alongside the repurposed wing from an infection control perspective. And again, something we're looking at and how we can do that better. Equipment, we've all heard in the media how hard it was to get PPE. That wasn't such an issue for us, but looking forward, and our care team wanted to just ensure we had enough equipment for the longer term. And what we found hard to actually get in the short term was things like palliative care drugs and simple things like pulse oximeters that you take for granted that you could order and have delivered immediately. So for us, it was about looking forward not to this week and next week, but what we'd possibly need in a couple of months. As I said, we were preparing for the worst. Technology and core capabilities I have talked about, and this, I'm really looking forward to some of the presentations later today because I think we all learn from this. I said it earlier, we can perhaps assume what our staff, what our residents and what our families want with technology, but I'm not so sure we're always right. So what is it out there? I look forward to hearing what others have done well and what we've got to learn from this space. I do want to highlight, and I think we've all been in the situation that PPE did go missing, and that's something that I think we could manage better. It's not our philosophy to lock that up, but we certainly did have to ensure that we kept a stock. Eventually that was locked up, just really, again, planning for that worst and making sure we had enough stock on site. I guess the highlight I do want to say here is what's left to do, and of course that's to be vigilant. So we are absolutely sympathetic to what's going on outside of Queensland and the tough time that we have and will continue to endure. I think as an industry we need to stand up and be strong together and work together around what we've learnt from this. I try and talk to my team every day about the importance to continue to be vigilant. So in Queensland we've had restrictions eased, but it was only this week in talking to our public health unit they've said we'd like you to re-implement taking temperatures on arrival, and in fact that's what we've done this week. So it's keeping up to date and vigilant with what are the guidelines out there and what is absolutely best practice. I wanted to say thank you. I have to say I'm standing here talking to an empty room, and it's a really interesting way to give a presentation. I can't see you all, so I hope you can see me. So please be kind when you ask your questions. But I do absolutely appreciate for those of you that have logged in, and I really look forward to the rest of the summit. Thanks so much.